So we'll quickly try to look at the at another score. Okay, so we are looking at the Oxford hip score. Okay, there's also the Oxford knee score. So look at the two of them and try to make sense out of them. Okay, what do they actually use the two of them for? So that's what we got. Okay, so for the Oxford hip score and the Oxford knee score, you see that they are just short patient reported questionnaires. So they are used around the world and they try to examine what the patient is feeling. Do you understand? So they measure pain and they measure how much of the function is still maintained in people that have undergone hip replacement surgery or knee replacement surgery. Do you understand? Depend on the surgery you took. So for the Oxford hip score, you are trying to assess the pain and function ability in patients that have had a hip problem. Okay, yeah, this is a hip one, Okay, this is actually a hip one, So you have gotten the surgery, but how far is the surgery helping you? That's what the Oxford hip score is trying to assess. So there's about 12 questions, and the questions are around how much pain are you still feeling, how are you able to move, how are you able to, your daily activities, and the rest of it. Then each item is scored from number 0 to 4. Do you understand? How well they are doing or how intense it is. Then the total score is within 0 to 48. So if you have higher scores, shows you that there's a better hip function and less pain. If you have lower scores, shows you that the surgeries have not helped and it's becoming worse and worse, Then for the Oxford knee score, it's similar to the hip score, but this one is focusing on the knee, especially in patients that have undergone knee replacement surgeries. So 12 questions are there, mainly around pain, daily activities, and the rest. So each question is scored from number 0 to 4, and the total range is about 0 to 48. So higher score shows you that the person is recovering better, while a lower score shows you that the whole condition is becoming worse and worse, So it's widely adopted in orthopedic research and clinical practice. So they use it to be able to track how, a patient is recovering. So why they matter is what? They are patient-centered, so they help the patient to actually express themselves, and they are very quick and easy, to pick out and do a survey, and they are reliable because the person is actually, telling their mind and all of that. So I think this is what we have for these ones.